wanted to say I have been doing dental hygiene for 35 years, and almost 20 years ago, I went to SCN, Linda. So I'm really excited to be here with you. Can you believe it's been almost 20 years?
I cannot.
It went by so fast.
54 this year, so yes, you were there early on.
Yeah, so it's really exciting. Thank you so much, John, for inviting me to join this group of influencers.
Absolutely. So we, the last, certainly, all day, there's been so much great insight, and the passion is increasing as we're getting on through the day. If you could share with everybody from your perspective, the work that you do, 5 minutes of your passion for this, what matters, what dental teams should do, how you see it would be awesome.
Yeah, so I work with the Dental Hygiene Department, but I take an integrative approach. So it's boosting the Dental Hygiene Department, optimizing their systems and processes, and then bringing everybody together to do that. So it's an integrative approach, which is what I think makes me different. One of the reasons why I'm excited to be here, well, first of all, let me just say I've been watching most of today, and I wanted to go back to something that Darren said a few hours ago. He said, doctors, you need to set yourself apart, and I think that's really important, and I think that's what I'm helping our client doctors and teams that we work with is to be different. And so I've heard some of the other speakers, other influencers say, it's really important that we let our patients know what is it that we're doing. Before you even start, before you put the bib on and take the patient back in the chair, let's bring them into the process of what we're going to be doing, because now we can help them to own their disease. I wanted to just kind of recap for people who weren't watching earlier. Somebody said, the other thing I loved what Chris Kramer said is most people, people say when you're checking out, they go, oh, would you like to make your next appointment? I go, don't ask them if they want to make their next appointment. Nobody wants to really come back to the dental office, So let's take out that worry about telling our patients that they have disease or cancer. I mean, as far as oral cancer, I understand what Chris Kramer was saying. I have doctors that are like freaked out because I'm going to talk about this oral ID, which is my favorite technology for screening. And our clients, usually I come with this in hand to our client offices and we start using it and they love it. So this device called Oral ID by Forward Science, it's really important that you let your patients know part of what you're going to be doing in today's visit is screening for abnormalities. And we're going to check we're going to check your lymph nodes. We're going to check the floor of your mouth and your tongue, and even as far down your throat. So I wanted to say that this light doesn't go all the way down the throat, but this light will show you cells that are abnormal, that have some change. By changing the light, you have to go to Forward Science, and you can learn on the website oralid.com. You can get some training on this if you don't know about it, for those that are watching. But whatever you can see with this light, that's where you can see. So if you can look down their throat as far as you can look down, you're going to see if they're abnormal cells. You can feel my passion probably for this, because it's, I heard some other influencers say that as a hygienist, we couldn't really find anything or see anything until it was stage 4, which is so true. But I think with these higher end technologies, the fluorescent light, it can shine light and show us the abnormal cells. I want you to know that the largest cancer center in the United States is using this device to detect abnormalities. And so we're not telling our patients they have cancer. All we're doing is telling our patients that they have abnormal cells. And I heard, was that you, Linda? They were talking about, I think, Linda, you started the conversation about, so many of my clients have used this oral ID, and then they referred to the oral surgeon, and the oral surgeon said, I don't think it's anything, let's just watch. And my question is, what are we watching? And like Linda, you said it so well, is let's at least be proactive, saying there is something there versus just waiting and watching. And so it's really important that we have set ourselves apart to do something differently. And even when the patients check in at the front desk, Forward Science has created a system around this. So your patients have information upon check-in. That's what we teach with our clients. And this is that integrative approach where they're checking in and they know this is the service that's provided. It's super important to let your patients always know that you are doing an oral cancer screening. So many times I've been on airplanes and they see me working on my PowerPoint slides for dentistry because I'm going to speak somewhere or work with a client. I'm working on my PowerPoint and they're like, oh my gosh, what are you doing? Are you a dentist? Oh, no, I'm a hygienist, but this is what I do. And so many people will share with me, one lady lost a lot of her palate and nobody ever told her they were doing an oral cancer screening. She had no idea until she was having a crown prep on the maxillary arch. They found something while they were prepping her crown, and they finally found the stage 4, and she actually had a prosthesis in her palate. And she was sitting next to me on a plane. I mean, I can go on. Our office manager, her mom this year was diagnosed with stage 4 oral cancer. You're hearing it more and more, and I think this is so amazing that we're doing this presentation here together. I'm on a mission to help as many healthcare professionals to work smarter and not so hard. And I've created a down to a science time management formula. It's like you imagine a pie, and then there are 4 pieces of that pie. They are not all cut in equal 4 pieces. They're different sizes of that pie. But that first piece of the pie is your wellness exam. And that's where you're sitting there with the patient, building rapport and explaining what's going on. And this is one of those things.
Absolutely. Debbie, again, I mean, just like we just said with Christine, I think that, what today is, and this passion is there, it's been there, and I just think it's so encouraging to see more people speaking up and being passionate about this, right, Rob and Linda? It's there, and you guys have a platform, Debbie, whether it be the practices you're working with, like you said, establishing those hygiene protocols. It's so important. So, I mean, we could sit here and you could, like you said, you could probably share 5 or 6 stories and, for a long time. But I want to thank you so much, for coming on and sharing even just that one story about, the importance of making sure that they build it into their practice. So helpful.
Yeah, and I think that, what Darren said, I just want to take you back. Darren said, set yourself apart. And then just recently, somebody else said, no one's ever done that before. And I think that when your patients are saying no one's ever done that before, now you've set yourself apart. So I just wanted to end with that.
Absolutely.
True. Good job. Thank you, Debbie.
Thank you so much, Debbie.
Well, thank you. I appreciate, Linda, you've changed my life.
Thank you.
Thank you so much, Debbie.
It's been a great life. Yeah. Thanks, John. I appreciate what you're doing.
You got it. Absolutely. Have a wonderful weekend.
Yeah, have a great weekend, guys. Bye.
Okay.
Bye-bye.